We're now about to speak to Dr. Humphrey Zokufa. He's the Managing Director of the Board of Healthcare Funders, and he joins us from Cape Town to talk about sustainable future healthcare systems. Doctor, thank you for making the time to join us. I understand that you are on the cusp of a very important conference for the industry. Perhaps just give us a sense of the most gripping issues around private healthcare that this conference is going to be grappling with.
It's grappling with the issues of what contributes to the high cost of health care in this country and break that down. And then secondly, do we get value for money? And then thirdly, are the models that are in place to render health care in South Africa good models, or isn't there another way of changing those models and see how the delivery can be more integrated so that it can be more efficient and maybe more address the needs of the patient? And then what kind of legislative environment do we have in South Africa that is allowing us or providing a space for those things to happen? And then lastly, of course, the issues of human resources that is needed to be able to achieve those things.
Doctor, that's quite an ambitious list, and perhaps if we just take the first two issues, that of cost and value, how do you suppose a balance could be struck where the cost and accessibility of private healthcare becomes more attainable for the average South African, whilst at the same time making sure that the quality of the services doesn't deteriorate?
There are three things that you can look at for starters. One, to what extent are those who provide health care to citizens in South Africa adequately remunerated or adequately regulated or adequately given guidelines by statutory bodies or by current legislation so that they don't charge whatever they want to charge, and if at all that they want to exploit the situation in pursuit of whatever greed they may have, what system is in place that make it difficult. And then secondly, the products. We've done it with pharmaceutical products. If you look at the 203, 204 dispensation in South Africa, we introduced the single exit price dispensation for medicines in South Africa, and we are currently also controlling the dispensing fee that pharmacists can charge. That brought down the price of medicines. So why can't we do the same thing when it comes to radiological services and pathological services and also surgical interventions? And then you come to facilities.
Right.
Why don't you regulate the price of a bed rate?
Perhaps, Doctor, remind us again of the investigation that was had into the private healthcare industry, in particular looking at the cost and the value that the average consumer is getting. What was the outcome of that? And were the findings, are they going to be integrated into the discussions that you're having now? I certainly feel that we've had this conversation before.
Well, so far, what presented at our conference is that just looking at a couple of diseases, those diseases are not necessarily handled the best way, you would say, in the private healthcare sector. Now, if that is representative of other diseases, then one maybe can make inferences to what is happening with other diseases. Then when it comes to the cost of various pathological or radiological services or surgical interventions or bed rate, there has been no real study that we have done that we can quote. But the issue is this: about 37% of what gets paid out every year to healthcare providers by this industry goes to hospitals. And about 24% of what gets paid out every year goes to specialists. So more than 60% of what gets paid out goes to those two entities. So clearly what you're saying, if we're paying that much of those two entities, how come the healthcare outcomes are not that great? Which means you can't have a linearity then of saying, or you can't say there's a linear relationship between the high cost you pay and high quality outcomes on the other side. There must be something going wrong somewhere.
Absolutely. But what about the investor who is listening to this conversation and is looking to invest in the private healthcare sector? Are we, by tightening the regulatory environment, perhaps deterring the potential inflow of funds into the sector?
None of this is aimed at discouraging the investor from investing in healthcare. But if I'm an investor and want to invest in healthcare, I need to understand and appreciate what the legal framework is. And you can take it from Section 27 of the Constitution. It is saying, when it comes to health care in this country, the government has a responsibility to make sure that that health care is accessible and it is affordable. If not, it must do a lot of things so that it can achieve that, including legislative changes. Nothing there is saying there should be no profits. Nothing there is saying there should be no return on investment. But you will have to run whatever business you run, adhering to those principles of access and affordability, but in such a way that you can realize a return and also a margin.
Dr. Zokufa, understanding, of course, that there is a roadmap that's going to be coming out of this conference. We'll be looking forward to that. Thank you for making the time to join us. Dr. Zokufa is the Managing Director of the Board of Healthcare Funders.